diagnose, evaluate, and treat all types of epilepsy. The idea is to provide a comprehensive, multidisciplinary approach to the diagnosis and management of epilepsy. So this includes new onset seizures and also includes very difficult to treat epilepsies that have not responded to previous medications and even to surgery. It is the National Association of Epilepsy Centers that provides accreditation to epilepsy centers, and a level 4 center, such as our program here, is a center that provides the most complex and modern of treatments. So when should you go to an epilepsy center? If you have any diagnostic questions, or if you have continued seizures, then you must go to a comprehensive epilepsy program for a proper evaluation. In a comprehensive epilepsy program, new treatment options and different treatment options will be considered for your care. Of course, we make sure that the diagnosis of epilepsy is correct. We define the particular kind of epilepsy it is, and then decide what kind of treatment is to be given to you. A lot of patients who have difficult to treat epilepsy can actually benefit from other procedures, not just medications, but surgical treatments for their epilepsy. And it is a regrettable fact in many cases that patients wait a long time before this option is provided to them. So in a comprehensive epilepsy program, there are a variety of experts. There are epileptologists, who are neurologists that specialize in epilepsy care. We have epilepsy nurses, neuropsychologists, neuropsychiatrists, neurosurgeons, and neuroradiologists. So epileptologists are individuals who are neurologists and specialize in epilepsy treatments. So here you see epileptologists hard at work. They're reading EEGs or brain waves, they're analyzing brain scans, and working with fellows and residents in the care of their epilepsy patients. A comprehensive program also has epilepsy nurse specialists. In our center, we are lucky to have a variety of epilepsy nurses, those that work in the epilepsy monitoring unit in the hospital, and there are those who work in the clinic. So we have an epilepsy nurse navigator who guides a patient through the journey in the epilepsy program. And then we have epilepsy surgery nurses who specialize in guiding patients through the epilepsy surgery process. We have neurosurgeons. These are brain surgeons who specialize in treating epilepsy. And these surgical options that they provide can range from removing the part of the brain that is causing seizures to putting stimulators deep inside the brain to control seizures. And you'll be hearing a lot more of this over the coming day and tomorrow. So the activities in an epilepsy program are to do with diagnosis and treatment, the use of very specialized investigations in the diagnosis and management of seizures, multidisciplinary meetings where all these different specialists that I just spoke of meet together to discuss individual patients. There are comprehensive evaluations that are done that can include not just the epilepsy itself, but the comorbidities and the other problems that can come with epilepsy, such as depression, anxiety, and so forth. In the process of doing this, we educate residents, fellows, EEG technicians, and nurses. We conduct research, and of course, we also engage in community service, because we're very much a part of the communities that we live in. A neuropsychologist is an individual who tests patients for memory problems, for example, and the potential difficulties that patients may encounter during the processes of treatment, including surgery. A neuroradiologist is a radiologist who specializes in brain disorders, the diagnosis of brain disorders, and neuroradiologists can be highly specialized, specializing just in epilepsy alone, for example. A neuropsychiatrist is a psychiatrist who specializes in the treatment of patients with neurological disorders, and they are integral to an epilepsy program. An epilepsy monitoring unit is a specialized part of the hospital where patients are brought in and have EEGs and video assessments for their seizures to see precisely what kind of epilepsy they have, to see indeed if they have epilepsy in the first place, and of course, to monitor patients as they go through the epilepsy surgery process. So the EEG technicians are those who keep a constant watch on what's happening to a patient in the epilepsy monitoring unit. And so here you can see patients who are being monitored with brain waves and videos. And here is our EEG technician keeping a watchful eye on proceedings. So in the Epilepsy Center, we carefully review everything about you: the history, medications, EEG recordings, brain scans, and other specialized tests that are done. And following that, we discuss your case in the Epilepsy Patient Management Conference. This is a thorough discussion with inputs from all the assembled specialists. And after that, we come up with a treatment plan. So the patient journey is one of seeing an epileptologist, having the epilepsy correctly diagnosed and treated. Seizures often resolve with that process. In some patients, there are ongoing seizures that require specialized testing. Patients are then discussed at the multidisciplinary conference. Management is then decided, surgery or no surgery. And if epilepsy surgery is done, seizures often resolve or improve. So in summary, an epilepsy center provides comprehensive care because it has a full range of specialists that examine each aspect of a patient's epilepsy. Each patient's case is thoroughly and holistically examined. We provide patient-centered care in a comprehensive epilepsy program. And I emphasize, one must not settle for continued seizures. If you have seizures that are ongoing and not responding to treatment, you require assessment in a comprehensive epilepsy program where many treatment options will be provided to you. Thank you very much.